All right, welcome everybody to this month's National Equine Health Call for the equine industry. Thanks for those who have submitted questions or suggested topics or speakers for today's call and future calls. I greatly appreciate it. I'm going to start with some announcements. First announcement is there is a New World Screwworm Symposium September 24th and 25th. Co-hosted by the U.S. Animal Health Association and the National Institute for Animal Agriculture. The link is at the bottom of your agenda for today's call. I also want to call your attention to the upcoming USHA Committee on Equine meeting, which will be coming on November 3rd in Denver, Colorado. And if you want more information or have any questions, please feel free to contact Dr. Joe Fish, excuse me, or Dr. Mike Odian, who are the co-chairs of that committee. Additionally, the AAEP, American Associations of Equine Practitioners, their annual meeting or convention is coming up in December. And just of note, the Infectious Disease Committee meeting is on Sunday this year, on December 7th. There was a typo in the agenda. I apologize. It says December 2nd, but it is Sunday, December 7th at 11:30. This is different from prior years where they had Saturday meetings. This meeting for the Infectious Disease Committee is actually going to take place on the Sunday. So those are some meeting announcements that are pertinent to the health and well-being of our horses in the United States. At this time, I would like to just continue on in the agenda to get some screwworm updates specifically. We did ask USDA if there were any updates they'd like to provide, and they said they had no additional new updates for this call. They did refer folks to their website, which is linked in this announcement for this call. They did encourage folks to visit their website and sign up for some news alerts. And again, to receive the news alerts and information, I did provide that information in the agenda. I did receive a question regarding what is the current outbreak in Mexico and the current numbers. In reviewing that page, you will find a map, which I'm going to bring you to. Hopefully this works. So you will see here on the map that there is at the, the screwworm outbreak currently in Mexico through August 30th, 2025. And again, this is on the USDA website. Through this date, there has been a total of 5,920 cases identified and 743 active cases. And you will note that the most north active case is in the location of Veracruz. So again, this is on the USDA website. The other thing that I'd call your attention to on the USDA website is that they did have an announcement regarding a human case of screwworm that was identified and announced on August 26th. It was a human traveler that returned from El Salvador, and USDA did initiate targeted surveillance within the 20-mile radius. And to date, as of the posting on August 26th, all traps have been negative for New World screwworm. Currently, there are no New World screwworm cases in the United States. So again, these are the questions that were proposed, and we would encourage you to actually go to the USDA websites for additional information and tracking of the situation for New World screwworm. I'm happy to take any questions. However, I am going to probably refer those on to USDA for answering at a later date, but just call your attention to those updates of the recent detection in a human, their announcement as far as their USDA efforts and their 5-prong approach. And I would also call your attention to the map. There is one other map that is also been posted on the web that I am going to show you here. I'm trying to get it up. Give me one second. So this map does show, or graph, excuse me, does show all of the detections for Mexico and Central America, and you can query each additional country. I will call your attention to the total numbers. The total numbers, and again, this is for the end of July, this map, graph and data is for. At the end of July, there were 20,215 cases that have been confirmed, and only 9,000 of those, or excuse me, 900 of those were in equids. So these are the questions that were posed, and I hope that gives the answers to some of the questions. At this time, I will open up the lines, and if you have a question, you can either put it in the chat, or you are welcome to just unmute yourself and ask any questions you may have. Okay, hearing none. The other questions and information was coming up related to what are we doing in the equine industry, related to the drugs available or emergency use of drugs for horses in the event of a New World Screwworm circumstance. And so what we did today is we invited the folks from the Food and Drug Administration to give us an update on their processes and how their role in New World Screwworm is. So I'm going to turn it over to Dr. Tristan Kalanis to start us off. Tristan, there you are.
Well, hey, good afternoon, y'all. My name's Tristan Colonius with the Food and Drug Administration, Chief Veterinary Officer here. I would be remiss if I did not also give a shout out to Dr. Ellen Hart, who is our programmatic lead on the New World Screwworm response at FDA, and Dr. Amy Philippi Taylor, who is one of our reviewers in our Office of New Animal Product Evaluation that focuses on equine drugs. If I get into any detailed questions outside of my depths, I will be quickly turning over to either Dr. Hart or Dr. Philippi Taylor. But going to share with you a little bit about today, what is FDA doing for animal drugs that can treat, prevent, control New World Screwworm. So I'm going to dive right in. Next slide. So we're the Center for Veterinary Medicine at FDA. We regulate animal drugs and devices, animal biotechnologies like gene editing. We look at the safety of animal food, and we have a lot of responsibility to ensure food-producing animals result in safe products for humans. And I flag this because one thing we don't regulate, as many of you may know, but just to be clear, we do not regulate pesticides. So there are some topical non-systemically absorbed products like fly sprays that would be regulated by EPA as pesticides. So if you've got a question about those, we're not able to help you, but we've got plenty in our toolbox we're working on, and we're certainly talking a lot with EPA and USDA on this response on a regular basis. Next slide. So overall, USDA's sterile fly program was incredibly successful in eliminating this pest in the 1960s, 1970s, and pushing it all the way back down to the Darien Gap. And of course, it's headed back up. But that's left us in the United States with no approved FDA products with an indication to treat, prevent, control screwworm for any species. So we've definitely got some work to do to prepare for the potentiality of screwworm arriving here. And of course, we all hope that these significant efforts by our federal partners will keep it at bay, but we've got to be prepared. So we are really looking to facilitate access to animal drugs for New World Screwworm as part of this broader response, working with USDA, CDC, and EPA. And, drugs are going to be an important part of the toolbox, but by far, they're not going to be the only thing that's going to be important in this response. So treatment and prevention options will not be one size fit all. There are anti-parasitic resistance concerns with drugs. Drugs are not going to be the complete solution to this. It's going to be important to think across the board about management, animal movement, sterile flies, what our partners are doing in Mexico to really respond to this terrible pest. Next slide. We've launched a website. We've got a link here. We've got a handy QR code if you've got your phone out. I think you'll see these QR codes again at the end of the presentation. We've got some good information here for every audience on what we're doing on the animal drug front, and we're adding to it as we make progress and as we better understand the threat. So what you see on the website today may not be everything that's going to be on the website next week, next month. So I would encourage you all to keep checking back on this website. We're going to keep it updated. Next slide. So as we think about what are the animal drug needs for a screwworm, we've got a lot to think through. There are a lot of animals, particularly in Texas, which is at most threat, given if you watch some of the detections. Of course, we're thinking across the United States, a lot of different species. What's practical? What might be used as a countermeasure in deer is what is not the same that you're going to use in a cat, and it's not just the route of administration, it's practicality. We've got food producing animals, and as I mentioned before, we've got anti-parasitic resistance concerns, and that's both to the screwworm, but also to other parasites that we know we're managing on a day in and day out basis. I know we know this, but we really have to approach pest control in an integrated way. And if we overuse or over rely on these tools, we may lose them not only for this pest, but for other pests. Next slide. So one of the first things we did is we sat down and we said, all right, let's look at what markets are using in countries where this pest is endemic. Are there drugs out there that are being deployed in these countries that are not approved here? And we found a few. We've looked at the literature to understand, has there been scientific data published, particularly in countries where this pest is endemic, that can help us understand what, products may be effective, including different classes of antiparasitics that may be already approved and on the US market for other indications. And we've been working a lot with the animal drug industry. We call them sponsors, but those are essentially your companies that produce animal drugs. And so this has really started to give us a sense of what's the landscape and where do we have gaps. One of the first things we did on our webpage, again, another handy QR code, is we've launched a list of animal drugs that are approved in the United States, antiparasitics that are on the market, for which literature exists about their effectiveness in treating or preventing screwworm in certain species. This list is an important resource for veterinarians to guide extra label use. So under the Animal Drug Use Clarification Act of 1994, Congress, gave authority for veterinarians to use FDA-approved drugs extra labelly in many scenarios. And that's going to be one of the most important tools if the screwworm was to get here tomorrow, ahead of us approving additional products or adding screwworm-specific labels to these products. And so this is an important resource. Now, as you'll see, we've got data for cattle, for some livestock, and a lot of data for dogs and cats. Unfortunately, we have not found any literature specific to or supporting any specific products for New World screwworm for horses. To borrow a phrase I think Dr. Hart came up with, it's a bit of a data desert. But this is still an important resource. And like I said, as we become aware of additional scientific data and we're looking for it, and if y'all have some, please share it with us. We will keep this table updated. Next slide. Like I said, we are not content with extra label use and the scientific data that exists being the only tools in the toolbox for veterinarians and producers. So we are working hard to see, can we bring products through some of our approval pathways? So we've got our traditional animal drug approval. We've got something called supplemental approval, which is essentially adding an indication for screwworm to a product that's already approved. So like an injectable macrocytic lactone that may be already approved for a number of other indications. We've got a conditional approval pathway, which is a bit of a fast track pathway. We can get products on the market before they've fully proven effectiveness through our conditional approval pathway. And I think an important thing that we've unlocked for the first time is emergency use authorization. So Congress has given FDA the ability to have a much more flexible review standard that we can act much more quickly on, called emergency use authorization. The agency has a lot of experience using this in the human space, things like COVID-19, but this is the first time we've been able to consider using it in the veterinary medical space. And I just highlight that because we are really breaking glass and breaking barriers here to see how we can bring safe and effective products on the market for screwworm and try to fit the gaps we currently have in the toolbox. So EUAs, how do they work? So Congress gave us the law and said, first, to unlock EUA authority, there needs to be a declaration. And this declaration can be issued before the emergency is here. So about a week and a half ago, 2 weeks ago, the HHS secretary issued that declaration that considered that New World screwworm presents a significant potential for an emergency. So the door is now open for us to issue EUAs. The declaration applied only to animal drugs, given this threat is primarily poised to animals. And we've got needs for prevention, treatment, and control in animals. And humans, the primary management strategy is debridement of the larva and management of the wound. EUAs act just like an approval, so they're product specific. So we will need to work with sponsors and review each individual EUA request on an individual basis. But as I said before, the standard gives us a lot of flexibility to move much more quickly than the traditional approval pathways. So that's our overall response. What does this mean for horses, which is why we're all here? So like I said, no FDA approved or authorized screwworm drugs for horses, but you're in the same boat as every other species right now in that regard. And there are real data gaps regarding the safety and effectiveness of some of the countermeasures for horses. So we have not found any publication specific to treatment or prevention of screwworm in horses. And for those products that have been used in other species, there's limited safety and effectiveness information. Like I said before, drugs are going to be only one part of an effective management toolbox. That's going to include husbandry practices. I know USDA wants animal owners and veterinarians out there looking for potential myiasis that can be reported. So we're actively picking up if we get an incursion here. Wound management will be important, thinking about your husbandry practices that might inflict a wound. And we're going to need additional data to help inform if we can get some additional drugs with a specific screwworm authorization or approval for horses. And I just want to underline one opportunity here. We've got a minor use and minor species program that provides incentives to get drugs to the market. During our last few years ago, Congress was considering our user fee bill for animal drugs. These are the fees that industry pays for reviews. They get reauthorized by Congress every 5 years, and they're an opportunity to get policy updates. And in both the House and the Senate version of that bill, there was a provision that would allow FDA to consider changing and moving major species to minor species based on the data. And as we looked on the data, the first species that we would consider likely doing that for would be horses. Unfortunately, that provision did not make it into the final bill. Even though there was generally broad support for it, we didn't find a lot of opposition. But I just want to put that in your court that there are, I think broader potential legislative changes that could open the door for more incentives to get more horse drugs developed and approved writ large. And we certainly are interested in continuing to work on that issue because we would like to see more approved products, more research, more development in equine therapeutic product space. Next slide. Concerns we've heard, and we want to continue to hear concerns from y'all as we work on this and try to expand the toolbox and expand the information we can provide veterinarians and animal owners, and work with sponsors and try to encourage them to bring products and data to market. We know movement protocols and requirements are going to be a big concern for you. We've heard it from a lot of y'all. Again, parasitic resistance, not just to the screwworm, but to the parasites that we have to manage day in and day out in horses. And then, as I think is clear, we do not have good treatment or prevention options for you. We don't even have good data to help inform extra label use decisions by horse veterinarians who are going to be on the front lines of making some of these decisions if this pest gets here. Before we hopefully have some approved or authorized products. This is what we've been hearing, but we want to continue to hear from y'all because it can help us guide, what we're prioritizing, how we're engaging with drug sponsors, with researchers, with other partner groups to try to move the needle. So certainly work through your, associations. We're talking with them on a regular basis. We want to hear those concerns and figure out if we've got an ability to address them, or at least have an ability to raise them with others who may be better positioned to address them. Next slide. So I'm going to stop there. That's an overview of our response. Here are QR codes where you can go to our webpage. Like I said, please visit it. We're going to continue to keep it update. We've got FAQs on there, kind of like I just said. If there's an important question that you're getting a lot of that might make sense to go on this page, please send that to us. We want to try to build out as much information as we can to be helpful. And as we do begin to approve or authorize products specific to screwworm, this is where that information is going to be compiled as well. So really encourage y'all to take a look at our web pages. So I will stop there and hand it back over.
So I have received a couple questions, and if folks want to use the chat, please do so to post your questions, or you are welcome to send those questions directly to me. So I will start with the questions that I've received so far. Regarding, folks have heard that ivermectin is effective. Is there really no published data for effectiveness in horses on ivermectin?
I'm going to let Dr. Hart or Dr. Philippi Taylor jump in on that one.
We are not aware of any published data for horses in particular for ivermectin.
Okay. And I would just add that from an industry's perspective, we have some concerns if we start using ivermectin, that there is going to be an increase in resistance in the parasites that we are using that drug for. So we have a very significant concern about increasing our resistance in our horse population for parasites specifically. Second question, I think I'm going to reword it a little, but have you looked at articles that are in Spanish only?
Yes.
Okay. And then another question is, have you reached out to health officials in other countries to get their experience with horses?
Yes. Yeah, we're working. There's we're collaborating. We have a little tiny but mighty group of equine focused people across USDA and FDA, and we are brainstorming every week trying to come up with strategies for how do we learn more about what products people are using that are actually used to this. So we actually have one of my coworkers has a friend who actually practices in Brazil. So we are getting information from every source we can think of, and we are happy to hear any information that or contacts that people have, because it's basically all hands on deck at this point.
So I think this is a reiterated question, but what drugs have been identified in other countries that they are licensed or marketed for horses for screwworm?
I'm happy to jump in, and Amy, please edit after me. So, we're certainly working with sponsors, and unfortunately, we're not able to share specific confidential data about those sponsors working with us. But what I can say is we have talked to countries there are a number of products, for example, various topical products, I would say, that we're aware of in countries that may have multiple species indications. And we're working with those companies in hopes that, we can get some data submitted and that they're willing to consider, emergency use authorization or maybe even pursuing an approval pathway. And we've been very proactive in that. And like, Amy said, we are going out and saying to health officials and to the sponsors, what do you got? Are you willing to bring it here? What data do you have on it? Can we work with you quickly? We've got this EUA flexibility. How's your supply chain look? And we're having, those conversations right now.
Can you please provide clarification on whether or not topicals fall under FDA?
It depends. So we work regularly with EPA and FDA in jurisdiction, but in general, if it's something that's going to be, systemically absorbed, and a number of the topicals we're looking at based on the active ingredients or therapeutic ingredients and then fall in there, that will be on the animal drug side. And Dr. Hart, feel free to correct me or add to that.
Yeah, how I usually describe it to folks is if it's topically applied and it treats only external parasites, it's typically EPAs. If it's topically absorbed and gets any internal parasites, it's ours, or if it's administered by any other route. Generally speaking, there's always exceptions.
And I think this is kind of on the same lines, this question. Is any premises treatments for screwworm would fall outside of FDA and would be EPA licensed, correct?
Typically, things applied to premises to the environment are regulated by EPA.
Those are all that I have so far. Give me check one more time in the chat. Are there any additional questions for the folks from FTA? Can somebody put the link to the your veterinarian information page in the chat, please? Is that possible?
Yep, you can do that.
Thank you. Okay, I believe that's it. I really appreciate you all coming on today and giving us this update so that we can understand what you need from the industry and how we can help work with you. Because obviously we are concerned if it does get here, we would need additional information from you all on how we can best treat our horses from a prevention standpoint as well as a treatment standpoint. So with that, I thank you all for your time and your willingness to get on with us today. And we look forward to having more additional conversations with you. And if anybody has any questions in the future, feel free to send them my way and I can funnel them to the appropriate folks at FDA. So thank you all. Appreciate it.
We appreciate it as well. We know this is not the last conversation. We've got work to do. And like I said, even outside of New World Screwworm, we really would like to continue conversations to think about how can we incentivize more product development and approved therapeutic products for horses in general. And we think there are some opportunities for that. Thank you.
Yeah, we greatly appreciate your willingness to work with the horse industry and moving things forward for us on the drug side. So thank you very much for your time and efforts. All right, I don't see any other questions. They did put the connections or links in the chat. So if anybody has further questions or want information, please visit that website. Moving on in our agenda, we are kind of moving a little quickly, but that's good. We did get a request for a USDA BLM, Bureau of Land Management update. And I'm going to turn it over to Dr. Lisa Rochette. And I know I probably killed your name, Lisa. I apologize in advance.
No worries about that. And I am going to try and get my, try and share my screen here. Just a second. Okay. Sorry about that. It takes a little. It's just to get that sorted out. Okay. Let's see. Oops. Sorry about that. I am on the wrong screen here. Okay. Can you all see my
Not
screen?
yet.
Not yet. Okay. Doggone. Okay.
Oh, now we're seeing, let's see what it comes up.
Okay.
Yep.
All right. Okay, so hopefully you see a slide now.
Yes, you do. You're good.
Okay, sorry about that. Thanks for your patience, everybody. Zoom acts a little strangely on my laptop sometimes. So anyway, but I really do appreciate the invitation to come and talk about this program with you all. We also do have Annie Evers from BLM, and we'll turn it over to her to talk through some of the specific questions that came up as we were prepping to give this talk. But anyway, I'll spend most of the time talking about our partnership between APHIS and BLM to provide support to some of their veterinary needs. And just to walk you through a quick history of this program, I'll start a little bit just about the program in general. I'm sure Annie can correct anything that I say incorrectly here, but the wild horse and burro interaction with public lands, has that issue is probably as old as the public lands themselves. But this Al Kane, our previous coordinator for the partnership, he used to always talk about how there was a movie, the Misfits, that really kind of highlighted the fact that these animals exist, and really just kind of highlighted the public lands themselves out in the Wild West, so to speak. Other Western films would kind of allude to the existence of these equine species out on the public lands. And over time, there were a number of different pieces of legislation that were passed to kind of address BLM's role in managing the public lands. But in 1971, there was the Wild and Free Roaming Horse and Burro Act that really influenced how these animals were to be managed. So the BLM, the Bureau of Land Management, they're housed under the Department of Interior, where National Park Service and some of those other agencies aexist as well. But they operate under a multiple use mandate that aims to balance the uses of public lands among different needs like recreation, oil and gas, that sort of thing. That mandate is for balanced use. It's not always equal use. That is an important distinction to make. And then by law, excess animals must be removed, again, to achieve that balance. They can have impacts on the environment and other species and some of those other multiple uses. So there is a pretty active population management strategy that BLM employs. Our formal APHIS and BLM partnership to support some of these activities associated with the wild and free roaming horse and populations, that was established in 1999. There had been some sporadic supports provided a couple of years before that, but this partnership was formalized all the way back then, and it has been in place up through today. We do see the partnership as being a really beneficial relationship that we have with our partner agency at BLM. There are some advantages that are offered to BLM, including a national network of unbiased veterinary expertise for field work. It can be, of course, impractical in some of these really remote locations to find a large animal practitioner that's able to go out and perform the required veterinary work that needs to happen. So that's one thing that we do have veterinarians in every state in the country, and can often get folks out to help on the intermittent basis that BLM needs. Typically, that support occurs in the form of gather support. So when some of the excess animals are gathered off of the public lands, we have a presence there typically. And then we also offer and support BLM through pasture inspections that we conduct that really are evaluating against BLM's own standards and policies that were developed and to achieve these goals associated with the legislation that requires the management of these animals. We also have generally maintained a headquarters staff veterinarian. That's our BLM coordinator, Dr. Al Kane, which many of you know or remember or have worked with. He did vacate his position and headed for retirement in the past few months, and so currently that position remains vacant. I'm wearing some parts of that role as one of my hats right now, but we are hoping to be able to replace Dr. King's position at some point. There are, of course, benefits to our agency as well. One is just we have the opportunity to be more active in a kind of a unique sector of the horse industry. These animals are, as you'll hear when Annie talks, they are often rehabilitated, adopted out, and so just kind of engaging with that piece of the industry has been really important to have access to that population. The relationship also does allow us to plug into a population of horses that do have a connection to our mission. Obviously we just heard the screwworm presentation. There are public lands down along the southern border, and so just keeping those lines of communication and that relationship intact helps us work with BLM on the things to monitor for and ensure that we all know and work together if we do need to if we do find something in that population. And then there's a benefit to the animals, of course, as well, in that these animals benefit from the experts in range management over at BLM, but also from our expertise on the veterinary side of things. So I think it's it's really a partnership that draws from the best of both worlds. Common activities that we'll perform when we do provide support to animals that are being rounded up or gathered up will include that we're just we serve as a neutral observer. There is often a lot of attention on this activity, so we do ensure compliance with their comprehensive animal welfare program standards. We'll also advise when there's a need for emergency injury treatment. We won't necessarily provide direct support for complex injuries, but we can certainly make some recommendations about when it's important to refer to a nearby clinic or how some of these injuries might be handled. We will conduct necropsies in the field upon request of BLM. There have been events where something infectious seems to have been going on, or we just need to dig into why an animal might have died, and so we'll provide that support in the field. And then we're also available to help consult in a case of a potential need for euthanasia. And again, that's a lot of that work really is evaluating against the standards that BLM has developed. And we're, again, just there acting as an impartial party to ensure compliance with those standards. Just a current status of the partnership right now. As I mentioned already, Dr. Al Kane vacated the coordinating position for the partnership back in May. We are continuing to provide some gather support whenever we can. Our staffing resources are limited at this time. We are working to try to build up our veterinary rosters again to be able to provide this support. As you all are probably aware, I'm sure, we have the avian influenza response that's ongoing, and so that can take up some of our staffing needs as well. So when we're not able to provide that support, BLM does go out to work with contractors, other veterinarians. So they're generally, not without a veterinarian on site. It's just, some of the logistics become quite a bit more challenging. We, are continuing to, engage and keep each other aware, both of our, of the gather activities, any of activities associated with the partnership, of course. Just communicating about what our staffing resources look like, talking about topics of mutual concern. That again, screwworm is an example there. And then we do still have our agreement is active. So the partnership is still officially in place. Like I said, it's just the way our support looks right now is much more limited than it used to be. But again, we do have our agreement on the books with BLM. It's funded through fiscal year 2026, which starts on October 1st. And then we also have kind of our formal agreement that has been established with BLM that runs through the end of 2027. So again, the partnership is still alive. It's much more limited right now, but we're still working closely together here to help each other out. And then for some of the specific questions that you all submitted beforehand, I will turn it over to Annie.
Hi, everybody. I'm Annie Ebers. I am the off-range branch chief for the Wild Horse and Burro program at the BLM. So that means that once the animals come off the range, that's under, that's my program. And then there's also, I have a counterpart who's the on-range branch chief. You want to hit the next slide, Lisa? Oh, there we go. So I'll give you some data and facts. So as of March 1st, we estimate that we had 73,130 animals on the range. Most of them are wild horses, over 50,000, and then almost 20,000 are wild burros. Our estimated population increase since March 1st has been 15 to 20%. And we have only removed about 4,000 animals in that time frame. And so a conservative estimate would put this total wild horse and burro population on the range somewhere over 80,000. You want to hit the next slide? All right. So getting into the off-range program, the BLM has 42 off-range pasture contracts. They can be as small as 450 acres and then as large as 46,000 acres, average is 20,000. Our pastures are long-term, we're envisioned as long-term care, where animals, it's meant to replicate at least some characteristics of the range, and animals graze on these pastures mostly in Oklahoma, but also Nebraska, South Dakota, Iowa, Kansas, Missouri, Montana for a little bit longer, Washington and Wyoming. We have 28 off-range corral contracts. These are short-term facilities. When animals come off the range, they go to a corral and they're prepped, they're vaccinated, and we care for them until we can make them available for private care. Get rid of the pop-up. And if they are either quite old or somehow unsuitable for adoption, that's when we generally say, let's send them to a pasture. They're better suited for life in a pasture. So right now there are almost 40,000 animals in our off-range pastures and about 25,000 animals in our off-range corrals. So this year we gathered slightly over 8,100 wild horses and burros from the range, and then we removed almost all of them. The rest we had to return. They're mares or jennies that were treated with fertility control vaccine, and then we send them back out. So the remaining animals that were gathered and removed from the range are then transported to those off-range corrals, and they'll be made available for private care placement through adoption, which is somebody takes care of an animal for a year, and then they can get title to that animal for sale. Certain animals can be sold. They are either over 10 years or have been offered for adoption 3 times. Or transfer, which is a direct transfer to another federal agency or state or local government as a work animal. Or we transport them to off-range pastures for that long-term life grazing in Oklahoma. Getting to our placement numbers. Oops, can you go back, Lisa, for a second?
Sorry about that.
That's okay. I might know that off the top of my head, but so as of this month, we've placed 7,287 animals into private care. Almost half of them were sold, the other half were adopted, and then transfer just happens a lot less frequently because those are usually trained animals, which require some level of effort, and there's just not as much demand. All right, next slide, please. Okay, so let's get into budget, which is stressful. So the 2026 President's budget request is $106 million. The Senate and House markups are at the last 2-year levels, which is 141.9 million. We do have an advisory committee. We were not able to have a meeting this year, and we have not been able to solicit new members. All right, any questions?
Annie, I think one of the initial questions that was presented was regarding that advisory council for the terms that expired. Are they extended, or are those terms, those individuals done?
So for the terms that expired, those individuals are done.
Okay. And there's no solicitation at this time? Is there any anticipation for when there would be new members solicitations?
No.
Okay. Give me 1 second to see if you have any questions, you can come off mute or put those questions in the chat. I may have missed this, but how many roundups did they do this year?
The total number of gathers, I'm actually not sure.
Okay.
But we gathered like the total animals we gathered was 8,100.
Okay. I believe that answers all of the questions that were posed to me in advance of the call. Are there any other questions that folks may have at this time? I am not seeing any, but I will forward them on if I receive any. So thank you very much for your time and taking to give us that update.
Thanks, Carrie.
Thank you.
Thanks, guys. Okay, just a few announcements. Again, just a reminder, the Screwworm Symposium in Kansas City on September 24th to the 25th. U.S. Animal Health Association Committee on Equine is coming up on November 3rd in Denver. And the AAEP Infectious Disease Committee is meeting Sunday, December 7th in Denver. Our next call for the National Equine Health Call will be on October 9th. and I welcome any information or questions or topics suggestions. Thank you again for your time, and I'm going to give 10 minutes of your time back to you today. Have a great day.